From April, frontline NHS staff in England will need to have the COVID jab or will be moved to another role away from the front line. The move has sparked concern among hospital bosses who fear they will lose staff when the new rules come in. And for one GP who is yet to be vaccinated, the issue is so contentious she's written to the Prime Minister. She's with us now, Dr. Fui Mee Quek. Hello to you. Thank you very much indeed for joining us. We did try and have a chat yesterday. There were some technical issues. We're going to give it another go today and see how we get on. Thank you for joining us. Why don't you want a COVID vaccine?
Yes, can I just pick up on one thing first? You mentioned frontline NHS workers. It's not just frontline, it's non-clinical staff also. And I wanted just to clarify that.
No, what I actually said was they'd be moved away from the front line.
Yes, they could be, but also it does affect the mandate for the mandatory requirement affects non-clinical staff. That is porters, receptionists, secretaries also. So
why are you not having a vaccine?
Yes, well, as a doctor, I'm pro-vaccine, okay? I just want to make that really clear. I'm not anti-vaccination. I've had all my vaccines and I've made sure my children have had them as well. I encourage my patients to have their vaccines, and vaccines have saved millions of lives over the years. The issue is more the choice. And the reason I wanted to come on air and also to talk to Boris, especially in a very busy week for him, was to say that there are people out there like, there's a lady, there's a medical secretary called Mirren, and she works in Worcestershire, and she is in her 30s, she has 2 young children, and has decided not to have the vaccination. But she is so worried and she's crying her eyes out because she's probably going to lose her job, and she's not sure where she will be deployed to. She says that the voices of the unvaccinated health NHS workers are unheard. And I wanted to come on air to be their voice, to be the voice of those people. She's not patient-facing.
OK, doctor, I want to know why you won't have a vaccine.
I've looked at the risk-benefit analysis like I do for all drugs that just come out on the market. So naturally, as soon as any drug or vaccine comes on the market, I will wait before I prescribe it or wait before I actually take it myself, just to see what sort of side effects come out. But also there are other issues, like for myself, I got COVID, I had some immunity, and also I had some other illnesses. So I might have some predisposing factor to be more likely to have a side effect, for example, very rare side effect, but maybe that's and I'm at the end of my career. I've been in the same Sutton general practice for 28 years. I'm nearly retiring. So for me, I was looking at the risk and the benefit, and I thought, well, I'm going to retire anyway. I'm at the end. So I don't, it was my decision not to have it.
What about for the benefit of your patients? I mean, we're not doing it just for ourselves, are we? We're doing it for the benefit of society. I actually put this to Dr. David Lloyd, who's one of our regular GPs, and he says that any medical worker who refused to have the vaccine was being irresponsible.
There are lots of people that we face, and what I wanted to come across to say is that there are lots of non-clinical people who will lose their jobs.
That's not what we're here to talk about, Doctor. We're here to talk about why you don't want to have a vaccine. And I've put to you that our regular GP says you're being irresponsible by not having a vaccine. I'd like you to reply to that, please, if you would.
There are many irresponsible behaviours, but we don't criticise other people for. So, for example, the vascular surgery ward is full of people maybe who smoke, and we don't go about saying, oh, you're so irresponsible for smoking, or you're on the liver transplant ward and you have drunk alcohol. We don't not treat people because of the decisions that they have made. The issue is that the COVID crisis is petering out. I mean, we had good news yesterday that the cases are going down, and it looks like, coming towards March, Michael Gove said that we should learn to live with COVID. And Boris Johnson also said that he was going to roll out a programme for how we're going to do that. But in the meantime, this mandate has occurred. And on the 3rd of February is the deadline. And that's coming up really soon. And I'm really worried that we're going to be so caught up with the party and leadership challenge and all this, that we're going to forget that come 3rd of February, that's the deadline for NHS workers to be jabbed. And then we're going to face a crisis, because I understand that chiefs are very worried, but doctors and nurses, people aren't speaking out, they're not being heard. It's important that Boris understands that he could be making an even worse mistake, right? The parties in the past, we have to look at
let me just put this to you, Doctor. We're almost out of time. If an 85-year-old patient of yours came to see you, and as a result of you not having been vaccinated, they contracted COVID from you, with whatever effects that might have, how would that make you feel?
They wouldn't necessarily have got it from me because I wouldn't necessarily be carrying COVID. You don't know what my antibodies are like. You don't know that I'm not protected
less likely to carry COVID. It gives you some immunity if you have your vaccinations and your booster, unless you're flying in the face of everything else that we've been told.
No,
are you right and all the other doctors are wrong?
No, you are likely to be safer if you have the boosters and vaccinations. That's not the issue. The issue is that even if you do, you could still transmit the virus. And if that lady contracted it, not necessarily
so you reduce the odds. You reduce the odds.
You can reduce the odds, but the point is that I'm worried that people are going to lose their jobs and the NHS is going to really suffer.
But if
people are running out of time,
as a result of people not being vaccinated.
Sorry?
What about if patients die as a result of NHS staff not being vaccinated?
What if patients die because 10% of the NHS workforce, 100,000 people, have not yet been vaccinated, approximately? So if that happens, what happens when the nurses, the midwives, there's a whole unit of midwives who have not yet been vaccinated. Suppose that maternity unit closes, and that's what the chief is saying. That trust is saying that they might have to close that unit. So how about all the people, the women in labour who have to travel 40 minutes extra because they can't get the people
who I spoke to? Let me just put this to you, if I may. Kate Green, who I spoke to, a senior Labour Party MP, somebody that was looking after her mother in a nursing home. She was not vaccinated. Her mother contracted COVID and died as a direct result. How can that be acceptable?
It's not acceptable. It's terrible. It's terrible that that lady died. And now, I mean, most people, well, practically everyone in care homes has been vaccinated. But we know that even if you're vaccinated, you're
less likely to. Yeah,
you are less likely to. But you can. It's possible. Therefore, if 100% of the NHS workers are vaccinated, it's not still 100% effective. So what I'm trying to say is that the government must change their mind and do a U-turn on this mandatory vaccine before it's too late. The party was in the past.
They're not going to.
The party was in the past and they've made decisions. But this decision would be a really bad one.
OK. Doctor, it's good to talk to you. Thank you for joining us on the programme.